Well, as protests over public health measures persist, some provinces are easing restrictions. So starting today, vaccine passports are no longer required in Saskatchewan. In Quebec, gyms, spas and other venues are reopening at half capacity. Meanwhile, Alberta dropping masks in schools. Still, there's no clear consensus on Canada's next steps. With more on this conversation, let's bring in our infectious diseases specialist, Dr. Isaac Bogoch. Doctor, great to see you.
Yeah, good to see you as well, Anthony.
So in many provinces, as you know, they're easing restrictions. Some provinces lifting restrictions altogether. Is it safe to assume that we are at the point that we can go into that next phase where we can live with COVID? And what does that mean for you?
Right. I mean, for one thing, I think we've been living with COVID for 2 years, sometimes better than others. But I think we have to acknowledge that we obviously have to find a way to move forward while appreciating that this virus isn't going to go away. On the other hand, too, we have to ensure that this virus doesn't impact Canadian society and cause the significant morbidity and mortality that it has in prior waves. So that might include, having additional measures that we've seen. But of course, when the public health threat starts to abate, your policy has to align with the current public health threat and the best available science. And that means it's totally okay to start lifting some of these measures. Here's something nobody wants to talk about. COVID's not going anywhere. There will be more waves. There will be more variants. Obviously, we hope with vaccination and recovery from prior infection that we have good community immunity and good community protection so that these waves don't impact us as they have in the past. But, there might be a time where places that have abandoned mask mandates might need to reconsider that. I think it would be terrible to start shutting down schools and businesses again, but some light touch policies like masking may need to be reintroduced well into the future if things don't go the way we want it to go.
All right, I want to get more into that in a moment, but as we sort of approach this next step, and I sense caution in your tone a little bit, but at the same time, are we at the point now when we are just frankly dealing with a different kind of threat and that we need to see public health through a wider lens?
We absolutely do. I mean, we absolutely do. It's extremely important to recognize not just a singular focus on the virus, but of course all other facets of society. But you can't ignore the virus, right? We can't bury our head in the sand and pretend this doesn't exist, right? It's not every day that 25 to 30% of your hospital admissions are related to one single cause. So I think it's extremely important that we obviously not ignore what can be a significant public health threat and which has been a significant public health threat, but also acknowledge that we do have the tools to keep this at bay and to prevent this from impacting us here in Canada as significantly as it has. Listen, we're walking a bit of a tightrope now between pandemic to what we might consider as endemic. We're in this transitionary period. I think we'll see some turbulence along the way, but eventually we'll get there.
Now, the good and the bad of the last phase, if you will, with Omicron is that the numbers went sky high in a lot of cases, as we saw in many other countries as well. So it whipped through this country in many ways, but then there was a sharp drop. While there's a strain on the healthcare system, there's no question it didn't overwhelm it, at least, in comparison. But given that, and I want to ask you of the power of infection-recovered immunity, otherwise known as natural immunity, how important is that given this next phase?
Yeah, you obviously can't ignore that people who have been infected and have recovered from illness have some degree of immunity for some period of time. It looks like that might have been stronger with prior variants compared to this variant, but again, we're learning as we go along. There's some clues that recovery from Omicron people might not mount the same degree of an immune response versus prior variants, but they still do. And of course, that has to count for something. We have to appreciate that. I think the other important thing to recognize too is in the studies that occurred pre-Omicron, while certainly people who have recovered from infection have some degree of benefit and protection for some period of time, it looks like there's more robust protection from vaccination, more durable and long-lasting protection, especially against severe illness. And there are some studies pointing in that direction. So while both are important, vaccination is still an extremely important tool. And I think people who haven't been vaccinated should still strongly consider getting vaccinated.
Yeah, there's no question. I know we have about 30 seconds. I want to talk. Are we at the point now where we can have and focus on the targeted intervention, the testing of high priority groups? Not necessarily boosting 18 plus, for example, but focusing on the high risk groups in our society.
Yes, we certainly can focus on that, but I think it's also important to acknowledge that there is still uncertainty as the road moves forward and as we move forward with COVID. There are knowns and unknowns that lie ahead. We have to be able to adapt to whatever comes our way, and we can kind of predict what comes our way as well.
Well, we continue to adapt every day for the past, my goodness, we're now in the third year. Lots going on. We appreciate all your time and your insight, everything that you do. Dr. Isaac Bogoch, thank you, sir.
You all have a great day.